Hi, sorry, my video is a bit slow. So I hope you all had a nice stretch. We're going to move on to coping with fatigue now. So I'm going to go straight across to Jane Martindale, who's going to give her share her top tips with you all. Thank you, Jane.
Good afternoon. My name is Jane Martindale, and I'm probably known to quite a few of you within NAS and certainly within AStretch. This afternoon, I'd like to talk to you about the top tips for fatigue management. And really, this has been something that I've been very, very interested in. I first started to think about this in Birmingham, actually, at one of the NAS members' days, where I was asked to present about fatigue. What I'm going to try and share with you in this short time is just a little bit about the research that's been happening over these past 5 years or so, and then to actually go through some top tips that patients have actually told us. So here we go. The first few slides are really taken from the research that has been taken from Warwick, which was led by Dr. Nathan Pearson. And some of you may well know Nathan, have been involved with some of the research that he's been doing. And part of what we tried to do is to actually come up with a questionnaire that would help us to actually understand how patients were feeling with the fatigue, because we knew at the time that all you were doing was answering between 0 and 10 for how bad your fatigue had been. These quotations here are taken again from the research, and this is about how people try to make sense of fatigue itself, because I think for everybody it's such an individual sensation that you have. And some people find it easy to talk about and describe, but other people find it quite difficult. So just looking through the quotations that participants within this research has told us may actually ring true for some of you, but may not for others. There's certainly this thing about trying to live with fatigue from a daily sense, with some days it being better than others. And for some people, it's really difficult again to maybe even tell other people about how it's making you feel. And fatigue as well can make you struggle with everyday life as well, the way that you want to get on with your life. It becomes a struggle just to actually get motivated and to start to move around and to do things. What was really interesting from the research that Nathan did was that people talked about having energy. And energy and fatigue kind of fit together, and yet do they? And a lot of the other instruments that we used to measure fatigue previously hadn't really sort of like put these into two different categories. So the questionnaire that we have come up with actually has the categories of both fatigue and of energy. And people talked a lot about lacking in energy, about how they felt their batteries had run out. And we were quite careful to think about this, because batteries running out, you think about having those little monitors where you check between green being full of energy and red being very, very low. And it would be quite nice really if we could all wear something on our foreheads that would tell people around us, you know, that maybe we're hitting the red zone and maybe just be a bit kinder to you at that time. But again, with energy, it's about being bothered, and it's about motivation that comes into all of this as well. When you have less energy, then you struggle to live your everyday life. And that was a key thing for a lot of people, in the fact that they didn't want people to see that, you know, they were lacking in energy. They're just trying to keep going. But the quotation there about drinking 12 to 15 energy drinks, please don't try and do that. But again, that's how some people had felt that they were actually able to cope with their lives at that time. One of the key things, again, from the research was about people trying to achieve a balance. And I think this is really a very, very important thing to understand, in that everybody, as they live their lives, are trying to actually integrate living with their axial spondyloarthritis, but also trying to work out how best that they can cope with their fatigue. And having balance really is a bit like scales. And sometimes if those scales are tipped, which again, we know that it's very difficult with axial SBA, because you might get flares, which again would then make things a little bit more difficult to cope with. So we talk about, and the patients talk certainly about understanding about pacing and about having a routine and having to plan. And this is really things that come from learning how to live with the condition. But when things change, such as the flares and the unpredictability about that, then that is the time when it really gets more difficult and you struggle more. And then when the balance is lost, that's when things go wrong. when people feel that they're losing control both of their fatigue and of their X-bar. And it also can have detrimental effects on how people actually feel at that time, on their mood, and about this disengagement with their normal life. I talked to many people, and one of the things that they would have said is that if they feel so tired, then they would actually shun away from doing the social things, which again then started to spiral down into not being able to live a normal life that they felt they should be able to lead. So, what we as health professionals tend to do is to talk about the 4 Ps. This is making the most of the energy that you have. We talk about planning, we talk about prioritising your tasks, we talk about pacing, and we also talk about positioning. Now, there's an awful lot of the explanation behind these in the NAS leaflet about fatigue, which your wonderful Sally Dickinson and I hopefully tried to revise and to make it a lot more pertinent to people's lives. When we first looked at it, I think it was about 4 pages. Now I'm very sorry it's a small volume, but we've tried to cram absolutely everything that is out there to help people at the moment. And within there will be explanations for you about trying to plan things, trying to prioritise them, trying to help yourself to pace better. And positioning really talks about posture. So I'm trying to sit up nice and straight now. But if I was slouching, my muscles would be working and they will be losing energy. So all the things that we talk about normally can be put into making the most of your energy and all these issues that we are just about on the screen. What we tried to do as well with AStretch, but also with a small special interest group in the northwest of physiotherapists called the Assign Group, that I've been very privileged to have worked alongside now for over 12 years, was to actually go out and ask patients what they actually felt were their top tips. We called it a post-it exercise, whereby we just asked people just to jot down on a post-it what they did, what helped them to actually get through with living with their fatigue. These came into separate sections, and one of the sections was really when people talked about napping and sleeping. And I thought that this was the best one, because you'll know that all your therapists will always know best. We always do, because that's what's in our blood, really. And it's really nice to understand that actually you patients decide that maybe we don't really know best and you know best, which is actually true because you've got the t-shirt. So doing the opposite to what we're saying is probably going to work for a lot of you. So when people nap in the day, it makes them stiffer, which obviously makes loads of sense because you've got X-bar. And it makes you stiffer, so therefore the pain's worse. So it's better to keep moving, which an awful lot of people do, and then go to bed perhaps a little bit earlier. And again, what another person said to reiterate that was don't nap, that makes it worse. Short 10-minute rest boosts yourself and you can keep going. There's no science behind this, it's just really what the patients who wear the t-shirt think that works best for them. One of the other key things that people talked to us about was about moving. When they're feeling fatigued, they felt that it was much better to actually get up and keep going. When they're stopping, then it's making them stiffer and it gets worse, the pain increases. So therefore, be motivated, make yourself get up and move around. Going for the walk in the fresh air. We all know that in common sense, people even without X-bar know that if they get up and move around, that will increase their energy. And therefore, by increasing the energy, the fatigue feels less. So one of the things I would say is, when you're aware that your fatigue levels are starting to come or when your energy is actually dropping a wee bit, then that's the time to actually change position, move around, doing some exercise. I mean, we're always asking you to exercise, but you do that anyway because it's uncomfortable to sit for too long. But again, the other tip I learned with that was actually even at work, in the work environment, pace yourself a little bit more, be that little bit more kind to yourself and a little bit more aware of the tasks that you need to do, the ones that take more energy. Try and pace yourself so that you know that you've got the energy there ready to be able to get on with that. So we talk a bit about the general advice now. These are more sort of like, we couldn't put them into categories as such. But what people said to us with this was that once the fatigue sets in, try not to fight it. If you push through it, then it actually can make you worse. And in this case, it wiped that person out for days. So be aware of it, understand it, get to the point where you know how far you can push it and where you need to just step back a little bit more. Again, it's the pacing. It's about working hard, maybe for that 40 minutes, but being prepared to rest for 10. It's very easy to say things like this, but actually, the more you kind of like understand when your batteries are flagging, then that's the time to be that little bit more careful, and perhaps to just reduce the integrity of it, the intensity of it, and then be prepared to maybe sit down with a cup of tea and rest that time. Now, I think one of the key things from this, and certainly from my old research many, many moons ago, is this understanding and the sharing between yourself and your partner and your loved ones, because this is such an invisible thing to have. You can't actually describe how you feel, and it will be really difficult for me to actually understand how you feel. But just actually saying, I don't feel quite as energetic as I did, I don't feel quite as I should do, and actually being able to share that with your loved ones. It is hard, I know it's difficult, but you'll probably find that your partners actually can read you like a book. I know certainly with pain, my patients have told me many a time they don't need to say anything. The partner just picks up on it immediately like a second sense. And I think now that we're actually talking more about fatigue as well, and because of COVID-19, and we understand about long COVID and how people are suffering fatigue, then it's on the radar and people are hearing about it. We never talked about it before because there's almost stigma around fatigue. So don't be afraid of actually saying that I really don't feel quite as energetic as I did. I'm tired. That can really help, I think, sometimes as well, just to help you to overcome that little bit of that invisible barrier that's there. Having a strong cup of coffee, yeah, we all know about that one, the good caffeine fix. But it's the fact you've got up and gone to the actual kettle and made the coffee. It's the movement, it's doing something different. And I think really important advice there is don't give in to it. Don't do nothing and don't dwell on it. Because fatigue, I think, can overtake you. It can take you down and drag you down. So don't let it do that. Understand that it's there, that it's a concept that we're all very much aware of now, and actually find the things that works best for you. Because I think as well, that's the hard bit, because fatigue, I think, can make people feel very, very low and very depressed and very worried. I think when you get into that sort of position, then it's harder to fight your way back out of it. But all of the things that we're asking you to do there about the 4 Ps are all things that you need to do for yourself, which again is something that is being kind to yourself and something that we need to probably do a little bit more of. I think especially in these days that we're actually facing, I've said the horrible word COVID-19, and it does keep cropping up because we're all having to live with it. So remembering to be kind to yourself. Fatigue is very, very real, and it's very, very variable day to day. And I think the stigma around fatigue is actually beginning to lift a little bit now as well. So rather than you kind of like keeping it to yourself, then I think being empowered to actually talk to your clinicians and to your therapists about fatigue is something that really we should be doing, that the dialogue should be opened a lot better now. Eat and sleep well, taking care of ourselves again is another really important thing. And I know with our exercise, with patients as yourselves, you're the experts on that. You know what you need to do to keep moving. If you hate the word exercise, I just say move around. Just stretch and move and keep going. Active relaxation sounds a bit odd, doesn't it, really? But I think active relaxation really, to me, means that you actually are taking time out to actually relax and relax properly and give relaxation, a really good sort of like goal. It's easy to just sit down and look at the sky, but actually sitting down and being kind to yourself and looking at the sky and allowing your mind to wander can actually be something that be very, very empowering. And enjoyment. I know socially we're all getting locked down again, so it's very difficult. We can socialise through this medium. We can also socialise in other ways, as in with talking to our friends, and probably talking to our friends more than we have done in an awful long time. And being solitary as well, enjoying things. I think I've read more, certainly in the past few months, than I've done for a long time, because it's like escapism as well that helps us to maybe forget about the horrible times that we're going through. We keep talking about these 4 Ps, and they are important. But it means that you have to actually take time out to try to do this. You have to look at your life and how it stands. You have to plan what activities you can do and plan them so that they are actually doable, achievable goals rather than being the whole thing. About pacing, about not being afraid to take a rest and not feel guilty that you're taking a rest as you're doing it. The prioritisation is really important. Do the windows really need cleaning? 3 times a month inside, because nobody's going to be able to come in your house now anyway, so who cares? And posture, again, being very, very mindful of your posture and making sure that at all times that you're doing things as best you can for your body. Set these achievable goals and make them meaningful, and be kind to yourself the whole time. Okay. So I hope that this has been hopefully a top tip session for you. But I also want you to maybe think about all the things that you've already been doing, because I'm pretty sure that the vast majority of you will have been doing an absolutely fantastic job about this. But don't be afraid to ask about fatigue. On the horizon, we're trying to get some money now to finish the questionnaire that we've started to do, which will make it so that it will be available for people in clinics to fill out. Because what we're still afraid of is the fact that if we do put interventions in, if we do find a fatigue fill, which would be absolutely amazing if we possibly could, then we need to actually be able to assess if it's actually working for you. So keep your eyes open over the next couple of years. Hopefully, if we get the funding, then we'll finish the questionnaire and people will be able to tell us in more realistic terms about how fatigue's been affecting them and what's actually helping. So thank you very much for listening.
Hi, well, thank you so much, Jane. That was brilliant. So I can see we've got lots of good questions come up. And so if you can come up to the stage now, that would be very handy, because I can't answer them.
Hi, I'm here. Hi, Sally. Nervous moment there.
So we've got quite a short time. So
okay.
It's by quick fire round. So I think that the first one is I think the $1 million question. So what non-pharmaceutical approach is best or has most evidence for managing fatigue in AS? Would you say exercise, or are you going to go somewhere else?
I'm going to say that I think that's only answerable for each and every individual. I think we're all so unique. If we had the fatigue pill, it would be fantastic, but we haven't got that. It's got to be, I think, a little bit of trial and error. You've got to see what works best for you, and actually to understand that it will be variable as well. I think that's the hardest part with this. So I've no answers, but I think explore. Don't be afraid to explore, try different things. And if one thing doesn't work, don't be afraid to move on to the next. I think the guide that we worked with together, Si, thank you so much for doing that, is probably the most comprehensive piece of sort of like written work that we've got. But our patients were amazing. We just gave them a post-it and they wrote things down for us. And again, it's a very, very much what works is best for you. I'm sorry, I can't.
That's okay. And I think if we could answer the question, everyone's lives would be a lot easier. But if you do want that guidebook, you can find it in the resources section on the NAS website. So our next question is fatigue in AS always linked with a flare, or can you get fatigue and not be in pain and not really have a flare?
Again, there's no real hard research behind that. We to be quite honest, we don't actually know. I think when people flare as well, I think it can be exhausting, because it's exhausting the fact that you've got more pain, and emotionally it can be very, very draining as well. So people do feel and report that they do feel more fatigued, yes, when they do have flare, but I think physiologically, I don't think there's anything there to understand that. One of the things I didn't say with the talk as well was sometimes with fatigue, if you start to do something else, if you use another side of your brain to actually help you move into another sort of like mindset, that can sometimes help with that. So I remember at our conference that time back in Birmingham, it was a long, long time ago, we actually asked the floor, and one person said to me, he went to his Xbox, and I've since heard a fantastic lecture from a chappie up in Scotland, I can't remember his name, bless him, but he was talking about different sides of our brain actually perceive fatigue. And it's our frontal lobes, the ones that are here, that really much into that. But if you move into your motor brain, perhaps when you were doing something like an Xbox, that can really help to sort of like take that away. So there are other areas out there where the research is starting to come, but we don't really know. Sorry.
Brilliant. But I think we've got time for one more question. I'll do a nice quick one. So can medication, for example, tramadol, increase levels of fatigue?
I'm not a pharmacist, so that's one thing I would say. So I can't actually comment really on medications. I think some medications do make you feel more drowsy, certainly, and you know, it's even with things like antihistamines can make you feel tired as well. So again, sorry, audience, I couldn't actually say that about that, but be aware as well that, you know, certain medications, there might be interactions there. Certainly, but for the pharmacist, I could answer that better. So sorry, Sally.
I should have chosen a different question. Thank you so much. I think our time is up, and we're going to move to Claire Jeffries, who is going to explain what's going to be happening in the next session with measuring your BASME. So over to Claire.
Hello, everybody, and welcome back to. For most of you in the audience today, hopefully you're aware of the BASME, or the Bath Ankylosing Spondylitis Index. We normally measure this with you in clinic on an annual basis, sometimes a bit more frequently if we need to. But we're mindful that for some of you this might be something new. Unfortunately, at the moment, obviously, we're not allowed to bring you in for clinic appointments to measure your BASME during the COVID-19 pandemic. There is work going on in the background to maybe look at this online, and in a minute I'm going to hand you over to my colleague Will, who will actually be undertaking some work with you to see if we can get you to measure this at home today. So the BASME allows us to look at your spinal movement and your hip movement, gives us a score out of 0 to 10, and we can see how restricted you are or how mobile you are whilst living with your axial SPA. So today, though, what I'm going to do is perhaps just talk you through a few movements do at home while we're not able to measure you in clinic, and these might be things that you want to do long term anyway, and that we recommend to a lot of our patients that we do see in our clinics. So to start with, looking at some home checks that you can do then. When should you actually check these movements? Well, basically, whenever you want to, just try and keep it roughly the same each time. So if you feel you want to test the movements in the morning, then do so. But if you feel a bit more mobile in the afternoon, you can do that as well. For those that you're going to measure against a wall or test against the wall, make sure you use the same bit of wall each time. We're going to use some books, so make sure you use the same books each time, the same pillows for the position laying down. So you get the theme. Try and keep it the same each time. Now, with regard to when to test these movements and your medication, again, it's really up to you. Some people will do it first thing in the morning. Some people like to take any medications like painkillers or their non-steroidals before they actually test this, to just give themselves a bit of a fighting chance. So the first movement we're going to look at is your chin tuck, and I'd like to say thank you to my lovely husband who became the model for these photos earlier today rather quickly. So with this movement, this is part of the BASME, so this will be really familiar to some of you. So pick a nice bit of wall, a plain piece of wall, feet about hip distance apart, with your heels, your buttocks and your shoulders against the wall. If you can, stand in that position nice and safely. You may just need your feet a little bit further away, and that's okay. What you're going to do is basically keep your eyes level and draw your chin in. So you're going to do a chin tuck and try and get the back of your head to touch the wall, the part of the head that we call the occiput. So as you can see in this picture, it isn't a forward bend of the neck or a tip back of the head. It's literally just drawing the chin backwards. Now, if you can't quite get your head to reach the wall, then what I want you to do is get hold of a book. It can be a thin book or a thicker book, whichever you prefer, and you're going to try and hold the book behind your head by tucking your chin in the same way that we've just described. So it may be that you need a thicker book to actually fill that gap, and the idea is to try and keep the book there and stop it falling down towards your shoulders. So make sure you've got a variety of books so you can try the different depths. Really challenge yourself and see if you can get down to the thinnest level of book or no book at all, but whatever you think you can do. Don't worry if you retest yourself one day and you can't quite hold the book there. It's okay. You can do some more exercises and then retest yourself and see if. Ask me why you need to do this exercise, and basically it's just fantastic for your posture. It helps you make sure you keep your chin tucked in and your shoulders back as well. So it will help you then converse with people because you've got a really good posture. It will help you look over your shoulder. It will help you raise your arm up as well because your position with your spine is in a good biomechanical position. So let's look at our next check that you can do. And this is fingertips to floor. Now, if you look in the first picture here, my wonderful model here looks as though he is touching the books really easily that are stacked up on the floor in this forward bend position. But if we actually look closely at his knees, he's got really bent knees because his hamstrings are really tight. And if we took the photo side on, as you can see, he's not quite reaching the books when he actually does this forward bend. So again, when you're doing this, make sure you've got a really good stack of books available to you so you can bend forward and get your fingertips as far as you can down towards the books. And then as you do the movement more repeatedly, or if you do some of your exercises and you retest yourself, if you find you've got a bit more flexibility, then you can just take a layer of books out each time and see how much further you can go each time you test yourself. Try not to bounce the movement though, okay? Just hold the static position. Now, this test or this movement is really important because it helps keep your hamstrings really flexible, which in turn can help you keep good posture because it stops you bending your knees too much or sitting with your hips flexed. And obviously, as you're bending forward, then hopefully we're moving the spine as well and keeping really good functional movement, because at the end of the day, we all do need to bend forward to load the dishwasher, tie our shoelaces, for example. So a really good test of movement. So if we look now at our next exercise, side bend. So we've got our famous pile of books again. So you want a nice, comfortable chair that you can sit in nice and straight and upright. Have a pile of books at the side. Make sure you keep your buttocks on the chair. Don't be tempted to lift one buttock up, and just see if you can side bend and touch the books at the side. You may find you can get all the way down to the floor, but again, you may find that you need a few books. And as you retest yourself each time, or you do a few exercises and you feel you can go a bit further, just take a book out each time. Just make a note of how many books you've got each time so you can retest yourself a few weeks later. So this position is really good to test your spinal movement and make sure we've got this side bend. If we look at the next movement, we're looking at trunk rotation. So the same chair, see if you can back it up against a dining room table, have an object like an apple or just your phone, anything that you've got to hand. You're going to try and keep your buttocks again on the chair, and you're going to rotate round and see if you can put the object on the table behind you. Looks easy, but if you've got stiffness in your trunk, as you know, this can be quite a difficult movement to do. So remember to turn to left and right when you do it. And if you find that actually the movement is really easy, just edge your chair away from the dining room table a bit. So you have to rotate a little bit further each time. You can measure how far the chair is away from the table, so you can reset it each time you test yourself and make sure you go as far. Or you can push the chair a little bit back again to make it a little bit harder for you. When you do the movement, make sure you allow your head to follow your shoulders and follow the movement of your trunk. So this exercise or test for your mobility is really good for your general trunk and neck mobility. And we would need this rotation for things like helping us to drive, or if somebody calls us or we're looking over our shoulder to see what's behind us. So the next movement you can then test is your ability to lie flat, which we know at the end of the day particularly can be a real problem for us. So get a pile of pillows, find a nice, comfortable, perhaps quiet place in your house. You're going to just try and lay down on your back. And this can be on the floor if you want to, or it can be on your bed, whichever you prefer. So have a stack of pillows that you know will support your head and neck, so you're not kind of holding your position or overstraining your neck muscles, and just lay there for a few minutes. And then gradually see if you can take a pillow out. And then a few minutes later, take another pillow out. And then if you can, see if you can get your head flat to the floor with no pillows at all. Now, expect to be a bit different day to day on this one, and take your time. You could lay here for a good 15, 20 minutes if you can, just gradually allowing your spine to extend. Now, this exercise and test is really good to make sure that we can extend our spines and get in a really nice straight or neutral spine position. So it's good for helping you keep good posture, and particularly to relax at the end of the day after we spent a whole day fighting against gravity, which naturally tries to bring us forward into that flex position. So the next movement to look at as well, and I'm not going crazy, this isn't about young children getting AS. This is just to perhaps consider measuring your height at home and doing this with your children or your grandchildren just to make it a little bit of fun for them and for you. So you could mark on a particular wall or just use a tape measure, making sure again that you're trying to stand against the wall with your heels against the wall, your buttocks and your shoulder blades if you can, but predominantly making sure that you're safe and as close to the wall as you can get. So just measuring your height against the same bit of wall morning or afternoon, whichever you prefer, or into the evening, but just trying to use the same bit of wall and same position each time, just to really check your posture, make sure you can keep your chin tucked in and your shoulders back and that really good neutral spine. The next one is to look at an arm reach and just simply trying to reach up to the door frame, whether it be right up to the top of the door frame if you can get your arm that high, or just as far as you can up the side of the door frame. Again, you could just mark it slightly if you wanted to, or just take a visual note of how far you're able to reach and just retest yourself each time. So this measurement or this movement to test is really good to make sure you keep good shoulder movement and arm movement overall. It will allow you to reach up to a top shelf, for example, to get a glass down for that glass of wine that you deserve at the end of the day, or your beer. And really importantly, it will help you hang out your washing as well. And hanging out your washing can be a really good test and marker in itself. And one of your members, Gillian Eames, some of you may know, set a challenge, the washing line challenge a few years ago. And she uses this as a test to see whether she needs to do more exercises to keep her spine moving and her arm moving. So it's all really good practice. And then moving on, just thinking about your general fitness as well, you can just set yourselves little tests to see whether you're able to keep the same fitness level. So can you walk a certain distance outdoors in a certain amount of time? Maybe round the block, you could time yourself on speed and try and keep to that speed each time you're doing the walk. Can you do a certain number of steps at home if the weather's not so good outside? If and when we're able to get back into our swimming pools, can you do a certain lengths in a certain amount of time? I know some of my patients try to swim underwater for a length and they time themselves, or indeed they see how many lengths they can do in one breath. Can you cycle a certain distance at a certain speed for a certain amount of time? Can you do step-ups at home, a certain number for a certain amount of time? So it's just these little things just to test yourself and see whether you're keeping the same level of fitness and the same ability each time you test yourself. So just ask yourself every now and then, am I having to push my car seat further back? Have I had to adjust my mirrors slightly? Does that mean I'm losing a bit of movement? Do I need to do a few more exercises? Can I still reach up for that glass on the top shelf or in the cupboard? So some final thoughts before I hand over to Will. Just try and make sure you do your checks, your movement checks regularly, but at the same time during the day with the same equipment and in the same location. Okay, expect to be a bit variable day to day. That's okay. Use it as motivation to really keep yourself active and to make sure you can achieve the same movement or the same exercise as you did the time before. Okay, and don't forget, it is okay if you do lose a little bit of movement. Just add your exercises back in. And don't get obsessed with this. We don't want you to check it every day. Every other week is okay. Once a month is okay if that's what suits you. But just little and often would be great. So thanks for listening. Keep your checks up. And I'm going to hand over to Will.
Thanks, Claire. And hello again, everyone. So we've got a little bit of fun for you over the next 15-20 minutes, as Claire just suggested. Some of you will have done this at the start of the meeting today, 12:30 till 1:30. We had a bit of a play with this, but we're really keen to try out measuring you via a virtual platform, which isn't really happening at the moment in the country for us physios and doctors, measuring you. And is there a way to do it? Does it work doing it over video conferencing? And we'd like you to feedback on that to us, and kind of we'll discuss it ourselves to see how we felt it's gone as well. There are 7, I think, of us physios here, so we'll all be on a table up on the 2nd floor. So if you go to the left of the virtual conference on your screen, you can click number 2 to go up to 2nd floor. and find a table. Come and join us if you'd like to be measured. It's not mandatory for anyone, of course. You could stay on level 1 and have a chat to the NAS team. I know Zoe's talking about the self-management resources, or you could chat to Sally or Jill or Laura or Helen, who are all down there, or you could stay in your tables and chat to each other. If, however, you'd like to bear with us and be measured, do come on up. You'll have had the resource sent. Don't worry if you don't have it to hand. And equally, don't worry if you don't have your goniometer that we kind of created for you to hand either. But as long as you're happy to have a play around with it and see how it works. Equally, if you have a tape measure, that will make it easier. And ideally for the measurements, you need somebody with you in the room who can look at the numbers for you. So this isn't for all of you, but we'd love to have some of you come up to the second floor and have a play around with the measures. We've got about 15 minutes, so we might get one person measured, we might get 2 people measured, but do come up in groups. There's no reason we can't measure a few people at a time around a table, or if you just want to sit on a table and observe, critique, and encourage, you'll be very welcome to do that too. So I hope that's clear. We're just about to go back into the conference room, come up to the second floor if you'd like to be measured. We're not allowed to keep your data, so this is just a practice rather than a genuine annual review for you. And similarly, please don't do anything that you don't consider to be safe as part of these measures. Thanks very much.